We have a person here who looks like they took a fall down the stairs. There were no bystanders around who could give us an eyewitness account of what happened exactly. We don't know if he hit his head. We don't know how many stairs he fell down. What we do know is he's laying at the base of a set of stairs, a flight of stairs, and he appears to be in pain. So what we're going to do is try to minimize the movement of the patient as we begin to inquire more about what may have happened and what's going on. Remember, the whole point of doing this is to figure out if we need to call 911 and get help on the way, or whether this person is well enough to be able to get back into regular life and just kind of walk it out. Maybe that could happen. We know that weird things have happened and we mysteriously can escape without injury or harm. We don't know how, but it happens. And then other times we have a true injury. So this is kind of how it's going to look. I'm not going to touch the patient, and I'm immediately going to say, "Sir, I'm Roy and I can help. I've been trained. I'd like you not to nod your head, just answer me with yes or no or descriptions. And then try not to move any parts of your body just in case you have broken bones or an injury, okay?"
Okay.
All right, I'm looking over your head. I don't see any bleeding. I'm going to check in his ears and look for any blood coming out of either ear. I'm looking in the mouth. Can you smile at me a little bit? There's no broken teeth that I can see. There's no blood coming from the nose. As I look at his pupils, they seem to be equal and responsive to light. You can also do that by putting your hand over and then bringing it back and seeing if the pupils react. If they don't, this could indicate that they have a concussion, some swelling in the brain, and that would be an immediate 911 call. Now next, he's able to talk to me, which means he's breathing and awake and has a heartbeat. So we know that there are none of those three reasons to call 911 immediately. So I'm going to ask him a couple questions. Sir, do you remember what just happened?
I was carrying some boxes down the stairs and I fell.
Okay. Do you know if you hit your head?
I don't remember. I don't think so.
Do you know what day it is today?
It's Tuesday.
Okay, and it's actually Friday. And then do you know like what year it is?
2001.
And it's incorrect. So those two incorrect questions might lead me to think that he did hit his head. He may have lost or may not have lost consciousness. It really doesn't matter. But that he may be suffering some altered mental status as a result of this fall. That's enough for me to say, you in the plaid shirt, go call 911 and come back. I might need your help, and bring an AED if you can find one. Now, at the same time, I'm going to continue with open-ended questions. Now, what does that mean? It means I'm not leading him to give me the answer I'm looking for. So I'm just going to generally say, can you tell me what hurts right now?
My neck and my back really hurt.
Okay, so bad that you feel like you can't move?
I can't move.
Okay, and are you unable to move your arms, or are you just trying to help your back?
I can move them a little.
Can you wiggle your fingers then? Can you wiggle your toes? So we're not seeing any paralysis per se, which would be another thing that might lead to spinal shock, which would then get us thinking as a responder, they could get pale, cool, sweaty, go unresponsive, and we might need to do CPR because of spinal cord injury. So if we do see any signs of shock, we're going to cover them with a sheet coat or blanket, and then we're going to continue to reassess the patient for airway, breathing, or circulation problems. If at any time they begin to show problems with unresponsiveness, they're not breathing normally, or they go into full cardiac arrest, we're going to treat them accordingly and wait for EMS to arrive. As a healthcare professional having to deliver CPR, a major complication can be when we suspect a neck injury with an unstable cervical spine. Now, a modification of what we might do is use the modified jaw thrust, which is the point of this training video. It needs to be used when we have a second rescuer so that we can apply both hands as we actually use the rescue mask with a one-way valve to seal the mouth and draw the jaw up in, which we'll show you in just a minute. The scene would unfold like this. Scene is safe, gloves are on, my rescue mask with a one-way valve is available. I call out to the patient, they do not respond, so I place one hand on the forehead to remind me not to move their head and neck. I tap on the collarbone. They still do not respond. I go ahead and access EMS by calling 911. Hey, you in the plaid shirt, go call 911 and come back. Bring an AED with you when you come, if you can find one. Now I'm going to assess for normal breathing and a carotid pulse. No more than 10 seconds, there's no pulse and there's no breathing. I'm going to begin CPR and call my healthcare professional partner with me. I now position myself at the head of the patient. If they're wearing glasses, I'm going to remove them.
2, 3, 4, 5, 6, 7, 8, 9, 30.
And now for the important part of how we actually apply the mask with the modified jaw thrust. We're going to place the apex of the mask over the bridge of the nose and seal the bell part of the mask just below their bottom lip and above their chin. But now look, we're going to use both thumbs to actually push down on the mask and use our 4 fingers to actually grab the mandible or the jaw and pull the jaw up into the mask. The jawline or mandible actually comes down and then hooks at the back of the jaw and gives the actual leverage points that we're going to be using to pull that jaw up into the mask. Remember, the goal is not to do a head tilt chin lift. We may have to do that if we're a lone rescuer, but now we have 2 rescuers, so we're going to do it this way. As we pull the jaw up into the mask, we go ahead and give our rescue breath. First breath goes in, we get chest rise and fall. Second breath goes in, we get chest rise and fall, and we continue with CPR. We're going to continue this CPR using the modified jaw thrust to minimize cervical spine movement until help arrives, an AED arrives, or until the patient revives.